very helpful in dealing with anxiety, despair, and so on. The cognitive framework that is provided by religious understanding of life, of spiritual understanding of struggles in life, they are also extremely important. We know that trauma, for example, traumatic experience can lead to suffering, to mental disorders, very often when the person does not have a cognitive framework to make sense of these terrible situations. And spirituality can provide some very important ways to understand, to make sense of this experience. Also, the religious rituals can also be very helpful and supportive to people. Even the prayer, for example, is quite common that people facing substance abuse, when they are in craving, many recur to prayer during these moments, and many of them report that this is efficient to them, for example, in helping them to cope. Also, listening to or watching religious or spiritual programs. This is also a very used spiritual coping strategy, and it can also be helpful. Prayer, meditation, as I said, and also the community service, attending religious services, deeper integration with their faith communities. It's related to what? To behavior activation, something that we need to do, for example, in depressive patients. The behavior activation to help patients to move out the bed and to go and try to keep doing things, and this kind of behavior activation is very important. And also the social support. I think one of the important aspects I think it was late morning, there was a discussion about the brain and the disease and the mental disorders and how much the person is in control or not of the problem. I think we should avoid the extremes. We should avoid both extremes, saying that the patient has full control of everything, is his fault or her fault, the problem. On the other side, it's also bad to say, oh, the patient has no control of anything, it's just a brain issue, you just need to take medication and it will fix his or her brain. This is not the case. And is also an important aspect that there are several studies showing that people who believe that mental disorders are just brain diseases, biogenetic caused, it is related to higher levels of stigma, higher levels of trying to avoid the person because they are afraid of this uncontrollable, unpredictable person. So we need to recognize the importance of brain issues, but we also need to recognize the other issues and also the importance of the person's own mind, person's own will in their own recovery. I often say to my patients that the medicines that I prescribe to them are very useful, but they will not solve their life, solve all the problems. The medications will put them in better situations for themselves solve their problems. I think this is